My name is Jenny. Been married to Terry for 40 years and we lived here in Mullingar. Terry was a big, strong fella. He was in the Defence Forces and he loved it. He loved computers, loved his family, very, very family orientated. He was always there, no matter where I went. If I came home, he'd be standing on the door with a smile on his face, always there. Terry was complaining of pain in his back. I was rubbing deep heat in. He was a diabetic for a long time, been to the GP. Diabetes was a little bit out of control. He got some bloods done and it showed that his liver tests were out of whack. We had completely revamped our bedroom. He'd pulled out the wardrobes, painted the walls, and he pulled up the carpet and his back pain got worse. So we brought him in to A&E on the Monday with his back pain, and they kept him and they scanned him Tuesday morning. And Wednesday afternoon told us that it was metastatic carcinoma. It was in his liver, his pancreas, his bones and lymph nodes. The consultant saw us at family meeting the next day. He said he couldn't give us a prognosis. He was referring Terry to the oncologist and he was also going to refer him to the palliative care team at that stage.
So when I first met Terry and Jenny on the first initial assessment, I think it was very important for family to be there as well, that we were able to get a sense of what their needs would be and how they could support Terry. Part of our role as well is educating families on how to manage symptoms at home.
When he got sent home, they referred him to the palliative care in the community, and we had physios, we had occupational therapists, we had the public health nurse, we had social work. There were so many people come to see Terry.
Terry got to go home for 2 weeks and this was very important for Terry. He wanted to get his finances and his affairs in order and spend some time with his family at home, but also knew the option to come back into hospital if he was deteriorating and couldn't manage at home.
But his condition deteriorated very quickly, very rapidly, and he ended up having to go back into hospital. And the hospital palliative care team were amazing. They were very frank and very open. And Pauline, the palliative care consultant, I remember sitting one day with them and saying, "Terry, I think it's time you talk to your children." We knew where we were every step of the way.
So often there is a preconceived notion that palliative care is about end-of-life care. And that is a part of what we do, but it's not all that we do. We meet patients earlier in their diagnosis, earlier the better, to establish that relationship. And by doing that, we're able to assess the patient's family and their needs, and really focus on symptoms that are stressing for the patient and their family. And we do this to ensure the patient has the best quality of life and that they get to live their life to the fullest.
The palliative care team, they were there the whole time. Even after Terry died, they were still there for us. They had remembrance services, and with the bereavement nurse, and both Caroline and Sharon, they'd send little messages to see how I was coping, was I all right? It was lovely to realise that it didn't just stop when Terry died, that they were still looking out for us and for all of us. What I wish I had known about palliative care, yes, it is about the end-of-life services, but it's more than that. It's before you get to the very end. They're in there, they're looking after them mentally, physically, spiritually, looking after the family too. They include everyone. So it's not just end of life, it's quality of life, and it is promoting the best life they can during that time.